We are humans. We have evolved to avoid seeing death. Seeing death in bad situations causes mental anguish to our primate brains, and most people only have a limited exposure. First responders are often exposed to more than healthy amounts of these bad visualizations. I'm Theron Becker, and I'd like to talk about some recent federal policies to help those first responders deal with the poor mental health that comes from their profession. More than one-third of U.S. first responders are dealing with mental health struggles at higher rates than other occupations. These struggles include anxiety, burnout, depression, PTSD, or post-traumatic stress disorder. In 2020, there were 127 firefighters, 125 EMS professionals, and 116 police officers who died by suicide. In 2023, 1% of all suicides were classified as first responders. Further breakdown shows that over half were law enforcement officers, 21% were firefighters, 18% were EMS clinicians, and 2% were 911 telecommunicators. The first policy to discuss is the Fighting PTSD Act. This is H.R. 472 of 2023 that was proposed to require the Office of Community-Oriented Policing Services within the Department of Justice to report on making PTS treatment available to public safety officials. There's varying degrees of each state has allowed workers' compensation benefits to be extended to first responders with PTSD. It hasn't gained very much traction federally across the country. Some examples of state policies is Ohio passed legislation in 2021 that just examined the eligibility for first responders. Missouri passed legislation in 2023 that did expand eligibility to workers' compensation for first responders with PTSD. Oklahoma is considering legislation for workers' compensation, and North Carolina is considering legislation to include supplemental insurance. So we've obviously got some ground to move to make this act work better for us. The opposition or the lobbyists that are fighting against federal addition of workers' compensation state that these claims are going to cause more litigation and drive up premiums as each side battles to this in the court system to determine the cause of the PTSD, whether it was work-related or not. Our first modification would be through the judicial branch to consider to continue to build case law. Specifically, we want to remove that burden of proof from the victims. So if the person suffering from PTSD is a firefighter or a paramedic or a 911 telecommunicator and they've got PTSD, by default, their profession has caused the PTSD, and that burden of proof is on the insurance and the employer to prove that there was previous existing circumstances or something outside of work. We could also use the executive or the legislative branch with probably less effect, but in the executive branch, we could have Department of Justice to refine their regulations within their scope of authority to more clearly define PTSD causes, which could be related more to the profession. In the legislative branch, we would need to lobby members of Congress to amend this act to more clearly define that the PTSD is caused by the profession. The second policy to review is the HERO Act. In 2020, H.R. 1646, or the Helping Emergency Responders Overcome Act, established a public safety officer suicide reporting system at the Centers for Disease Control. And it also established several grant processes for peer support and wellness programs and prevention programs for mental health, specifically for first responders. As somebody that's intimately involved with mental health for first responders, I have not seen any local effects from these grant monies. This grant money just does not filter down to local levels that I'm aware of at any situation. So we've got some work to go there. And again, this policy has not gained any traction. There are some local examples at the state levels. Ohio implemented a state level office to coordinate some mental health support and training, and Texas is considering a bill to increase the mental health leave for telecommunicators. Ways that we can work on improving this policy at the federal level would be we need to work more strongly to link all first responders in a preventative capacity with mental health clinicians. And at the national level, we needed a centralized organization or set of organizations to collaborate and to provide a single source of reference. In the legislative branch, there just needs to be more money and better processes to get that grant money down to local levels and to make local effects, specifically on prevention. Prevention of these mental health issues and exposure to PTSD. In the executive branch, the Centers for Disease Control should be working more on centralizing resources and having a repository of options and best practices that can be used across the country. In the judicial branch, we could file some lawsuits to challenge some of these provisions of the Act to better define a public safety officer and just clarify some of the language in this Act. Thank you for your time, and I appreciate all our first responders' work to help us all.